today we'll discuss about HCPCS coding. We've already discussed about LCD, CPT. The third type is your HCPCS. So HCPCS coding, again, we had seen in CPT, there were three categories, right? Category 1, Category 2, and Category 3. HCPCS uh, coding are level 1, level 2. There is one level 3 also, but level 3 has been discontinued. Okay. So the level 1 consists of CPT codes itself, and level 2 is everything which is not covered in CPT. Okay. So we had discussed about the CPT codes, right? So HCPCS codes is a combination of CPT codes and other medical supplies, drugs, and equipments. Okay. So HCPCS is covering all the treatment procedures, all that part. ICD is covering the diagnosis part. Now, apart from this, if the patient requires any other rehabilitation aid like a walker, a BiPAP, or oxygen, or any other equipment which is required for the rehabilitation of the patient, without which the rehabilitation will be incomplete. Okay? So even those things are covered in your coding. Okay, patient is already paying a heavy premium every month to cover the medical expenses. If the patient has to pay for all this out of the pocket, it will be very burdensome for the patient, right? So even those things are covered in your coding, and via coding, it will be covered in the insurance. Okay? So level 1 is CPT, level 2 is your medical supplies, drugs, and equipment. HCPCS is Healthcare Common Procedure Coding System. Level 2 codes are primarily used for billing, Medicare, Medicaid, and other insurance for non-physician services. Non-physician services is very important. CPT codes are all uh, physician procedures, right? So who gives the treatment? The physician. Who does the procedures? The physician, right? Or any healthcare personality, right? And it could be a nurse if it's a minor thing. It could be a nurse or um, like all any healthcare procedure. It's done by a healthcare professional. Okay. Now, if I talk about medical supplies, drugs, and equipments, they are not directly supplied by the physician or any healthcare provider, right? If you go to a doctor for with a fracture, okay, the doctor will treat the fracture, right? The doctor will put the cast, the doctor will, if required, do the surgery, medication, all that the doctor will do, right? But after everything is done, okay, the casting is done, everything, the patient is better, everything. Now the cast has to be for 6 weeks minimum. And if it's in the foot, the patient cannot walk for 6 weeks, right? So the patient requires a wheelchair if it's an elderly, or a pair of crutches. Okay. So the wheelchair or pair of crutches, the doctor does not provide, right? Where do you buy it from? From a third party, right? He will give you the address of some uh, person or distributor who is going to provide you with these equipments, or you can also go to certain those kind of distributors or shops where you can buy these equipments, right? The physician is not going to give you all these equipments. So these are all non-physician people which who are also part of the healthcare system. Okay, so those are non-physician. So HCPCS codes were formed by the Medicare and Medicaid. Okay, so they actually combined the CPT plus the level 2. Okay, so whenever we have any patient with a Medicare or Medicaid, we always take the HCPCS codes. Okay. The CMS updates the HCPCS. So we have seen CPT codes are overlooked by AMA, right? American Medical Association. ICD is overlooked by WHO. So HCPCS codes are overlooked by your Medicare and Medicaid. That is your Centers for Medicare and Medicaid Services. That is CMS. All right. So this is how your HCPCS coding system was formed. The first coding system that came into existence was the CPT. Okay. 19 before that, your written description of services and procedures was submitted. In 1966, the AMA uh, formed your first coding system, that is your current procedure terminology, that is CPT. After that, your ICD coding system came. And then in 1983, your HCFA common procedure coding system came into existence. Okay. So earlier it was not HCPCS, it was only common procedure coding system. Okay. And now we have CMS, right? Centers for Medicare and Medicaid Services. So the CMS was earlier known as HCF. Okay. So HCFA formed common procedure coding system. And in that, there were three levels. Level 1 was the CPT code. Level 2 were your national codes. And level 3 were local and regional codes. Okay. Then in 2001, HCFA was changed to CMS and HCPCS was and Common Procedure Coding System was made into Healthcare Common Procedure Coding System. Okay. So in 2001, the naming changed. Okay, but the origin happened in 1983, and HCFA formed Common Procedure Coding System. In 2003, the HIPAA came, and uh, all the procedures were set, regulations were set according to HIPAA. In 2014, your ICD-10 came into existence. Okay, so you see, earlier it was only CPT and ICD. Later, HCFA formed a common procedure coding system. Okay, the name itself suggests common procedure coding system. So it was made a common procedure where in one coding system only there was CPT, and apart from CPT, what all is not covered in CPT, everything was included. Okay, so it was a common procedure coding system. Later on, the common procedure coding system was renamed as Healthcare Common Procedure Coding System, and HCFA was changed to CMS. HIPAA. What is HIPAA? Health Information Portability and Accountability Act. So this is an act which overlooks security, privacy, and regulation of all the coding system and or basically all the digital health records and otherwise also the health records. Okay, so health records are very private to a patient. Okay, so the privacy and security of the information has to be maintained. So HIPAA is the law which overlooks it. So HIPAA, we already seen that in 2003, HIPAA regulations highlight standard code set requirements effective from October 2003. Okay. So HIPAA made use of HCPCS mandatory in certain cases. Level 1, we have CPT codes. CPT codes. So CPT codes are only digits, 5 digits. Some places you have a numerical, alphabet, and it is the codes for all your OPDs and IPDs, all procedures. Level 2 is everything which is not covered in CPT, that is your medical supplies, medical goods, and non-physician services. Consists of a letter followed by 4 digits. We have seen in the ICD code also. First is a letter and then there are numbers. But in ICD, you have first letter, then 2 digits, then a dot, and then 4, 5, 6, 7. Okay. In SCPCS, there is no dot in between. It's first is the letter, and then in continuation we have numbers. Okay, so 4 numbers are there, and first is your letter. The codes for hospital physician and other healthcare professions. Okay, so even your healthcare uh, people are involved. Okay, and non-healthcare people are also involved, because in level 2 there are some procedures, some medications, drugs are also included. Okay, In CPT only, it's only physician services, okay, or healthcare professional services. Level 2 is healthcare and non-healthcare, both are included. Now we have like how we have in ICD different chapters. Different chapters is resembled by different alphabets. Like chapter 1 is A and B, right? So like that, or cardiovascular is represented by I, right? So like that in HCPCS also we have different chapters represented by different alphabets, and each chapter has different significance. Okay, like you have the J codes. J codes are permanent codes for drugs billable under Medicare. Okay, again issued by CMS because it's HCPCS, used for community and hospital billing for outpatient physician administered drugs. Okay, so community and hospital billing for out in hospitals also you have an OPD, right? Outpatient. Okay, so in community and hospital billing for outpatient drug administration. C codes paid under hospital outpatient perspective payment system, again issued by CMS, again used for hospital based. Q codes, temporary codes for drugs billable under Medicare. And Q codes, temporary codes for drugs billable under Medicare, again issued by CMS. Again, it is community based outpatient clinic billing for physician administered drugs. Okay, so this was for community and hospital billing, and this is only for community. S codes are temporary codes for commercial payer use, issued by BC, Blue Cross and Blue Shield Association, and listed in HCPCS coding set. Now, there are certain codes in the HCPCS which are regulated by different bodies. Like we have the dental codes, which are overlooked by the Dental Association. The S codes are controlled or you can say monitored by Blue Cross and Blue Shield in association with HCPCS, okay, in association with CMS. Understand? So there are certain uh, code sets in HCPCS which are taken controlled by another organization in association with CMS. Okay, they are non-Medicare because it's not overlooked by CMS. Okay, so these are non-Medicare community and hospital billing for drugs and services. Okay, so we have different chapters in HCPCS. Uh, when you come to the coding course, you will learn everything about it. Now there are two. Now we are talking about Medicare and Medicaid. Medicare and Medicaid. Okay, so what are these Medicare and Medicaid? So Medicare and Medicaid are the federal insurances. Okay, Medicaid. Okay, uh, people who are eligible for taking a Medicaid insurance are ones who have a uh, they are the low income groups. Okay, people who have low income or low salaries. So anyone who meets income eligibility requirements regardless of age. Okay, so low income groups. Medicare are elderly people. Okay, so anyone who is above 65 years old are eligible for Medicare. Okay, regardless of income. Okay, so if the person is above 65, whether it is a normal income, high income, low income, whatever income it is, if it is above 65, it is eligible for Medicare. And Medicaid, anyone, whether it be a young, adult, old, anyone who has a low income bracket we are eligible for Medicaid. Funding of Medicaid jointly by federal and state governments. Medicaid, it is paid by the federal government, okay, through two US Treasury held trust fund accounts funded with payroll taxes, uh, enrollee premiums, and payments authorized by Congress. Okay, so Medicaid is totally under control of federal government. Medicaid is under control by or funded, more appropriate is funded by both federal as well as state government. Administration administered by individual states according to federal requirements, monitored by federal agency, Centers for Medicare and Medicaid Services. So Medicaid, because it is jointly funded by federal and state, so it is administered by individual states. Okay, but the um, rules, regulations, or monitoring is by the federal. Okay, so federal government is laying out down all the policies, but it is followed and controlled and regulated by the individual state governments. Okay, Medicare is completely administered by the federal government. Okay, out of pocket costs generally not out of pocket costs, sometimes a nominal copay. Okay, so Medicaid covers most of the expenses. There is very little where the patient has to pay out of pocket. Okay, obviously because patient is already a low income bracket person. In Medicare, there are deductibles for hospital and other costs, small monthly premiums for non-hospital coverage. Okay, now you can understand anyone above 65 will definitely have some issue or the other and will definitely require regular treatments, right? Most of them. So there are small monthly premiums which have to be paid for non-hospital. Okay, so regular checkups will be there for people who are above 65. Not necessarily every time they have to go to the hospital, but they always have some chronic illness, right? Which for which they have to regularly visit the physician, right? So they have to pay a small monthly premium for non-hospital coverage, and for hospital coverage, they have to give deductibles for hospitals and other costs. Okay. Benefits coverage varies by state because it's controlled by or monitored by state. Federal, so whatever, each state, whatever they have the policies, regulation policies, and everything, depending on the state, they can uh, entitle the patients for benefits. Okay, but it is obviously federally mandated. Okay, but before they bring about any rules, regulations, they have to get an approval from the federal government because it is under control of the federal government. Even though the state is monitoring and regulating, it is still under control of the federal government. Okay. So, what are the benefits? Physician, lab, X-ray, home health services, early periodic screening, diagnostic and treatment benefit less than 21 years. There are other optional benefits are prescription drugs, case management, physical therapy. That is your physical therapy, occupational therapy. So all these benefits can be achieved, can be covered in the Medicaid. Medicaid is under control of the federal government. So uniform access across the states. Okay, so uniform across. So everything is same all throughout the US. Okay, whichever state it belongs, the rules and regulations are the same. Okay, there are different parts. A, B, C also is there, and D. Okay, so A covers hospital services, B covers we can say OPD, medical care. Okay, C is a combination. You can customize it, and D is the prescription drugs. So we'll see some examples of HCPCS coding. Patient receives an injection of 10 milligram of methotrexate sodium in physician's office. Okay, we are talking about physician office. That is your regular clinics. What is the correct HCPCS? We had seen, right? J codes are community and hospital billing for outpatient physician drugs, right? They are the J codes. So answer is J9250. First is a letter followed by four numbers. That is injection methotrexate 5 milligram. Okay. So this is how you do the HCPCS coding system. When you get into the coding course, there will be a lot more to discuss about the HCPCS. This is just a general understanding about the HCPCS. Over here, we have more than 1,200 courses, more than 1,840 trainers, and we have already covered more than 4 lakh 70,000, 4.7 lakhs learners globally. And we have international certifications also from Dunster Business School, Florida Institute of Science and Management, and even the medical coding certifications. You can have the certification, you can have your CPC also, you can have your AAPC certification. That's all for today. Thank you.